Waldenstrom macroglobulinemia. It is a low-grade lymphoplasmacytoid lymphoma associated with immunoglobulin M paraproteinemia. It is common in elderly and male. It presents with anemia, splenomegaly, lymphadenopathy, and hyperviscosity syndrome. Hyperviscosity syndrome consists of nose bleeding, bruising, visual disturbance, and confusion. This picture showing papilloedema with dot and blot hemorrhage with flame-shaped hemorrhage. Now management. At first, chemotherapy with alkylating agents such as chlorambucil, fludarabine, and rituximab. Chlorambucil is the mainstay of treatment. It controls disease over 50%. Fludarabine is also effective, but it has more side effects. Rituximab is also effective. Plasmapheresis and blood transfusion. Plasmapheresis and blood transfusion is given with the patient with hyperviscosity and anemia. Thank you so much for watching this video.